Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week earned his doctorate in dental surgery from the National Autonomous University of Honduras and received his postgraduate training at the Louisiana State University Medical Center. He also helped write the curriculum and establish the East Carolina University School of Dentistry in Greenville, North Carolina. Currently practicing from Lexington, Virginia, please welcome Dr. Omar Paredes DDS. How's it going, Dr. Paredes?
Thank you, Shaun. It's going very well. Thank you for the introduction.
Oh, man. Thank you so much, dude, for coming on board this podcast. We really appreciate it, and can't thank you enough because I know how busy you are. You got a practice that's booming, man. We thank you for all the work, too. But, hey, I always like to start off talking a little bit about sports, and, man, what a game last night. Did you watch that Super Bowl at all? Or it was
Not at all. I don't follow any sports. Well, I'm boring in that sense. I don't follow any sports.
Nah, you're not boring, man. That's okay. It was a boring game, man. It was horrible. It was like
that's what my wife says.
Yeah.
She did watch the whole thing, and she was quite upset. Yeah.
It's crazy. It was like 3-0, man, for like in the first half, and then I think I almost tied it up 3-3, and then it went up to 3-10. You know, Patriots, winning the whole time, and then the Patriots got a field goal at the end, so they won 13-3, lowest scoring game ever in the Super Bowl, and least amount of yards ever scored, done in rushing, and what a nightmare of a game.
Well,
I mean, the Rams were like one of the highest scoring teams in the NFL this year, and it was just always been a shootout. And last one I get the ball is usually the one that wins because everyone was scoring every series, but this was like a defensive. Just a real tough game. I mean, I think we had like 8 punts in a row that it was like 3 and out or very few first downs for the Rams. But, the Rams were the youngest team out there. And, the coach is 33 and the other team's like 66. The New England Patriots, like quarterback, they call him the GOAT, the greatest of all time. He's won more Super Bowls and everything else, and he's like 41, 42, and then our quarterback's like 23, 24, whatever. So it was just, they got schooled, they got outcoached, they got outplayed, and the quarterbacks, what a difference between Brady and Goff. But, hey, I think everything happens for a reason, and when the Rams' time, I mean, we're a young team. I think we learned a lot. I think going forward, plus also we have a new stadium being built, and it's not ready for the 2020 season, and I got tickets for that season for that stadium, so I don't want to win it all till I'm in that stadium when we're there, and I think we got a Super Bowl there at the LA Rams Stadium in 2022, so if we can get there by 2022, I'll be happy, man.
Well, best of luck, guys. What can I say?
Well, thank you so much again for coming on. I think it's time for us to dental up. So tell me, why did you get into dentistry, and at what point did you think, I want to be a dentist?
I started as an electrical engineer, actually, and, I did about a year plus of electrical engineering studies, and I clearly remember sitting in a desk with a bunch of numbers and having this epiphany moment. I guess that's what you call it, right?
Yes, you do.
It's like, man, I can't do this for a living. I'll go crazy. I can't do this for a living. I come from a medical family. Everybody's either a pharmacist or a prominent physician. And I'm like, okay, I've seen their lives, and I don't want to do that. And I started doing some exploration and ended up in dentistry. And result was immediately shoot to the top of the charts. Yeah. Everything came easy. Everything was really straightforward. I guess it's the scientific mechanical abilities. It's what drew me in. And that's what made me a dentist.
That's awesome, man. So tell me a little bit, where did you attend school? Tell me a little bit about your school journey, if you could.
Well, I'm a graduate of the National University, Autonomous University of Honduras, the largest university in the country. And dental education is a little bit different than what it is here in the U.S. You do 5 years of studies.
Okay.
You get 5 years of studies. And basically, you finish your degree, but you don't get your diploma. You have to go and practice for, I would say, a health center, something set up by the Ministry of Health in the country. They'll send you into the villages and everything, and you are the de facto dentist in there. At the same time, you're writing your monograph, your thesis, whatever topic you choose, and you are the de facto dentist in that community. At the end of the year, you come back, you defend your thesis, you go in front of this committee, and then you apply and you get your doctorate in dental surgery. Okay. So education is a little bit different. We do a lot of surgery. It's battlefield dentistry.
No kidding.
If you want to call it that. Very poor areas of the country. So a lot of things are resolved surgically. A lot of extractions, a lot of impacted molars, cysts, and that sort of thing. So education is a little bit different in that sense. But that was my dental schooling. From there on, went on and set up a practice. At the same time, I was always involved in teaching activities and everything, managed to secure a position at the dental school. Eventually rose up to the ranks, became a professor of restorative dentistry, and had set up a private practice. Okay. Just focusing on cosmetic dentistry. Aesthetic and cosmetic dentistry and rehabilitation. Practice in there for about, I would say, 1996 to 2003. At that time, moved to the U.S.
You moved to Louisiana, didn't you, or New Orleans?
I moved to Louisiana, yes. Yeah, I'm the last crew of graduates from Charity Hospital.
No kidding.
I completed a 2-year residency, GPR residency in Charity Hospital. And this was just prior to Katrina happening,
No kidding.
So finished my residency, graduated. Within a couple of months, Katrina hit, and everything was a mess. By that time, I was already in North Carolina.
Okay.
Yeah. Been a gypsy. Sort of way.
How'd you like that? How'd you like that Louisiana food? That a little bit different than Honduras food?
Well, I'll tell you one thing. New Orleans in itself has the largest Honduran population outside of the country.
No kidding.
So you can find pretty much anything. But I love the Cajun food. I love that spicy food and everything. So I was like a fish in water down there.
Oh, perfect. Tell me about when you came to East Carolina University. What was that? Now, East Carolina, what part of is that part of North Carolina or South? There's not an East Carolina, right? No,
it's just this geographic area. Encompasses Outer Banks and what is called the Inner Banks in that area of North Carolina. I came there in 2005.
Okay.
And I took over a residency director position. The program was going up for an accreditation. The previous director had left. He didn't want to deal with all the hassle of the accreditation. And I was crazy enough to say, you know what, I'll take it and I'll get it ahead. So that's how I ended up in North Carolina.
No kidding. When you started your practice, you're in Lexington, Virginia. How did you come up with Lexington, Virginia?
I don't know why. Ever since I moved to the U.S., I was always like, okay, I was thinking of Virginia. Don't ask me why. Never been here. Didn't know much about the place. I knew that was where Thomas Jefferson was from, Mount Vernon, this, the other, and George Washington, and the whole thing.
Yeah.
But as far as being here, never. But I've always had that knack. 7 years into directing the residency program, helping establish the dental school and everything, I started getting itchy. I guess a little bit of burnout on the academic side. And it's like, okay, I've always liked the patient contact. I'm one of those guys that don't tell me that you can do it. Show me you can do it.
There you go.
And as I was becoming more an academician, I had less patient contact, had to involve more myself in other things. And that's kind of where I started drifting away. I wanted to get that back.
Okay.
And I guess I enjoyed the challenge of it. So I started looking around, looked at places in North Carolina. I wasn't quite convinced of North Carolina. Started looking at Virginia. My initial bet was Charlottesville, Virginia. That's where I wanted to be.
Okay.
So I looked at some practices in Charlottesville, Virginia to purchase, and it ended up kind of being what I envisioned for myself.
Okay.
So I had some friends working in a medical school here in Roanoke, Virginia, and I get a call and say, "Hey, we hear that you're out and about. We used to work together in North Carolina." And so we had done some research together and some things, and they said, we have a fairly young school of medicine. We've done research and HIV grants and that sort of things.
Okay.
Why don't you come here, set up the dental like you had it set up down there? We'll get out of your skin, and you roll with it.
Okay.
And so I drove from Charlottesville to Roanoke. Right in the middle is Lexington. I knew that I had been seeing a practice for myself for a couple of years. So me being typical me, called on the phone, made an appointment, came to the practice, and I said, "You know what? I'm really scared. I just want to see." And I got a tour of the practice. And I saw it was a practice with good bones. It was a fairly new practice.
Okay.
The doctor had some family needs that he needed to address, so he was leaving town. So a couple of years later, I ended up purchasing the practice.
Beautiful.
That's how I ended up in Lexington.
No kidding. How far is that from Roanoke? I've been to Roanoke, man. That's such a beautiful area there, man. It's just so green and it's like a whole different world out there.
Yeah, well, Lexington is about 45, 50 miles north of Roanoke, and we are about the same distance west of Charlottesville.
Okay.
So it's a beautiful area. Anywhere you look out in this place, it's like you're looking at a postcard.
Oh,
it's beautiful.
It's so
great place for children, and it's a great community. So I'm satisfied with the decision I made in that sense.
You ever been up to that homestead? It's up a mountain up there somewhere.
I've been at the homestead. Yeah, it's about 40 minutes away from here. It's beautiful.
A lot of history there, man. I think that was built in like 1700s or something. It's like 1800s.
Yeah, and
it's so beautiful.
And they keep renovating it.
Yeah.
But it's a beautiful mountain hotel.
Yeah. I went to a wedding there. My niece got married, and man, we stayed in one of the big whole floor suites. I think it was Thomas Jefferson's or something. It was freaking, It was so neat, man. It's like, and they have their little lake, you can go fishing, and then they have the pools. But yeah, it took about an hour to get up that hill, and it was storming hard. I remember, you don't just, you don't fly direct into Roanoke.
It's a beautiful place, though. Yeah, it's a beautiful place, though.
Oh, it is. What a place to get married for sure. Lots of memories.
Yeah.
So tell me, describe a little bit of the layout of your practice. Tell me a little bit about that, how many ops you got, and maybe a little bit about your staff, if you could.
I have 5 operatories.
Okay.
I have 2.5 hygienists, bordering on 3.
Okay.
But 2.5 hygienists, 2 front desk staff, 2 chairside assistants, 1 office manager, and I think that's it. That's 8, right? 7 or 8.
Beautiful.
8. So that 5 operatories, and we do mostly everything. From extractions, surgical extractions, wisdom teeth, to dental implants, CEREC restorations, full mouth rehabilitations. I've gotten my hands a little bit into everything in dentistry.
That's awesome. How'd you get involved with CEREC, man? You just way back in the day, or you just early adopter, or recently?
Well, I tell you one thing: being in academia gives you that advantage. You can try anything that's out there. So, with the past generations of CEREC, I saw the evolution of things. I remember in dental school, when I was in dental school in the 80s, and it's like, oh my goodness, they just made this machine that's starting to make crowns, and the process takes like 4 hours, and this and the other. And I said, someday I know that'll pan out. As it went evolving, when they introduced the Omnicam, that's when I took the jump. At that point, I had my practice, and I said, okay, I think that this does what I wanted to do in the time frame that I wanted and predictable enough.
No kidding.
So 1 year I purchased the CEREC. Following year, cone beam scan, full integration, and the rest is history.
Yeah, that's awesome. So do you have any associates working with you, or you're just the man? You got all of them up? Huh?
No, I'm just myself.
Beautiful.
Just myself.
What about, what's like your favorite procedure in dentistry? What's your go-to procedure that you love most, do you think?
You know what? I've been thinking about that because I knew that question was going to come around. I like a little bit of everything.
Okay, no, that's a good answer.
I like a little bit of everything. I guess I do enjoy the challenge.
There you go. Let's flip it. What don't you like doing? What is something that, hey, I'm going to send this off to the specialist, or I just don't want it. I wouldn't even do it on my wife.
So typically, my patients request that I see their children.
Yeah.
And I do see children by patient request, always with the caveat, first tantrum or anything, out of here.
Okay, there you go.
And I do refer children, and it's just I'm not adequately set up, equipment wise and everything. I don't have a quiet room, so it's I'm more geared up to dealing with adults. I do my own root canals, but if I see a heavily calcified canal or a retreat of a root canal, something that I haven't done, something that is not my patient, somebody comes from another place and can you retreat this? No. You're going to a specialist. There's that mechanic inside my head. How much time am I going to be tied in here versus how much time it should take me according to my head? So once that balance starts tilting off, it's usually, you know what? And you always got to look for the patient's best interest.
Absolutely.
If it's something that you fear there may be some complications and everything, I talk to the patients. It's I have an open relationship with them. I'm very transparent in everything. And so it's like, this is what I think you should go to a specialist. A lot of people still don't want to go.
Yeah.
Take it with a pinch of salt.
Absolutely. No.
That's what I tell people. I say, well, this is your choice. I would send you to a specialist. And I have a very good referral community nearby. So
yeah, I love. Someone told me a while back what they say is when they refer something out to the patient and they're like hemming and hawing about it, saying, "Oh, you could do it." That's when the doctor would say, "I wouldn't even do it on my wife," And it's just when they hear that, it's like, okay, I understand you don't do it. I wouldn't even do it on my wife, and I'll do anything for my wife, type thing. But you almost got to do that because I know the convenience for the patient. They want it done there and now, but sometimes, you just step into a big hole you don't want to, and you want to be able to sleep at night. So I see when to punt, man. You got to know when to punt for sure. So tell me a little bit about your marketing strategy. Do you doing social media? You doing mailers? You're working with the public sector? Tell me a little bit how you're driving patients to your practice.
We've done, I guess, everything under the sun.
Okay.
We've tried postcard mailers. We've tried newspaper advertisement. We've tried this. We've tried the other. We tried promos on our Facebook page and everything. And really, my practice business driver is my own patients. Referrals. Referrals is my primary source of growth. And it's, and I'm I tend to look at everything very critical. And I still haven't found one media that I say, oh my goodness, this is the substitution to Coke. And yes, this is the last thing that you're going to have to do in advertisement and everything.
It ain't gonna happen. Yeah.
It's just that thing. I haven't found anything, but thanks be to God, the growth of my practice is due to my patients.
Absolutely, and you know what?
They're too kind to me.
It's this. That's 90% of the doctors out there, that's their number one driver for patients to the practice is word of mouth through their own existing accounts that are happy, your own patients, and it's free. And it's just something, take care of your patients and let them know that, you know what, hey, if it's a referral program or whatever, however you work it, just to let them know, we appreciate you. Any, referrals of your friends or family. We'd, love to, have those. And it goes so far by asking and taking care of your patients to begin with, because you got to keep them happy and, and treat them well. But man, that is just so on the money with most of the dental practices and I've done this a long time, and it's the same thing with me. 60-70% of all my work I get in is from a doctor referral that, we'll ask the dentist, hey, dude, can you refer us any other dentists? And when they tell us their friends or their peers that, when we do try to contact these dentists, it just goes so far when it's coming from a referral from, a friend. And it's just the neatest thing, for sure.
I think patients are your best advocates.
Absolutely. No, you're so right there. What about on some of your education for your CE and stuff like that, dental conventions, gatherings? What are you going to any certain ones more than others? Tell me a little bit about what you do for your CE journey, if you could.
Well, I'm a member of the CEREC Academy, so typically I attend about 14, 15 hours of that yearly.
Okay.
Along with that, I do about the same thing in whether it be the American Academy of Implant Dentistry or Academy of Osseointegration. I'm a member of both.
Okay.
I attend some of that. The American Society of Dental Anesthesia, I'm also a member, and I attend some of those courses. So a little bit of everything.
Okay.
I like to keep my head busy.
Do you go to any of like the Chicago Midwinter, any of the bigger dental conventions at all, or
have you? Know what? I've never done an ADA. I've never done a Midwinter. I've never done the Hinman.
Okay.
Never done any one of those, and it's just I just go to very particularly focused groups.
Okay.
And it's like, I want to learn this, and this is where I'm going, or I want to go to this, and this is where I'm going. And it typically ends up like that for me.
Oh, that's
and then, you cram so many hours, like 60 plus hours in a year. And it's like, do I need to go to another one? No. So I just stay put.
I love that. It's just,
there's a moment where money and gain, you're just like, okay, am I really going to gain a lot of knowledge from going to this? No. It's probably just a social event.
That's what I find them to be a lot of times. I've done that dog and pony show for probably 20 years, and the last several years, I'm like, you know what? I can go eat dinner anywhere I want around home. I used to get excited, go to Chicago here and there. I mean, I still do Chicago because I just love that city, and it's a big thing for me for laboratory. They have a lab day; it's really big, so it's important for me to go to that. But I get in and I fly out. I fly out early Saturday morning, man. I mean, we got Chicago coming up, man, and it's like 20 below. It's just miserable weather, and it's always been that way every year. And like the Yankees right now, I think it just went over the last weekend, and it's like, dang. And so, so we're getting ready to go to Chicago, and it's like, good Lord, but I got CE that I need to get for my certification each year. And
I hear you.
You got to do it.
We got to stay on top of those things.
Yeah. God knows I can't take that test again, man. I haven't been on the bench in years, so I got to keep my certification up.
I hear you.
Oh, man, that's so funny. Well, dude, tell me a little bit on your thoughts on some of this new technology, like impression scanners. Have you thinking about getting into any of them, or have you looked into any of them?
Well, I do have a CEREC.
CEREC
Omnicam, and I can. And most of the work I'm sending to you guys fixed. Let's say fixed when there's a long span bridge, or something that I need to scan, mouth guards, occlusal guards, those appliances. I just use my CEREC, and I'll send that electronically to you guys.
I know, man. We love it. We love it, baby.
Yeah.
It's awesome.
It facilitates everything.
Yeah.
It does facilitate everything for me. It
really does.
I spend less time dealing with things, less time mixing plaster and vacuuming plaster and this and the other, just like the direct scan, send the file, and get your things back in a few days.
It's just amazing. It's so freaking accurate too, and it's just the neatest thing. I remember when that CEREC first came out back in the day, I was worried, and I have a lot of doctors that do the CEREC, and it's stuff, I worried about it at first, but I'm still getting all their other work. I'm getting the bigger bridges. I'm getting a lot of the implant stuff. I'm getting a lot of the stuff that, have to be done in a PFM where we might have to do solder indexes, stuff like that. But, my CEREC doctors and, my digital doctors are some of the best that we have because it makes your practice so much more accurately. It's such a high magnification when you're looking at these preps, and, you can't go to the next module unless that is clear at that margin and, the height of the preps. And it's just pretty amazing. Yeah. It's just such a neat thing. And like you were saying earlier, you had it when they came out with the Omnicam. You just, some guys had a vision of it that And I didn't have that vision. I thought it would be a fly-by-night product, but it's here to stay, and it's evolving. And I think other companies have stepped up too, like, got into the CEREC, world and away in their own systems. And I think, the prices go down and everything else. I think it'll become more mainstream, but good labs gonna have to set themselves apart with service and other products that can't be done chairside direct. We love those indirects. I know you can do a lot of stuff direct, but we love the indirects. All our veneers and all our implants and stuff like that. Man, it's just pretty amazing. Now, on your implants, have you ever sunk your implants? Or are you kind of sending those out and just restoring them? Tell me a little bit about your implants.
It all depends. Most of my implants I restored directly with my CEREC. I sent some cases to you guys, and just when I say, you know what, this would benefit more from a PFM type restoration or from a CAS abutment. There's applications for everything.
Absolutely.
In dentistry, there's no magic bullet.
Yes, you're right.
And many a time we get under the impression it's like, oh my goodness, I have this thing and it's going to do everything. No, it's not going to do everything. You either become really good at one thing or kind of okay at everything.
Exactly.
And that's the thing. We need to look for excellence in our products. We need to deliver the best. So in that sense, everything's got its applications. And it's like, okay, yes, this needs a human hand, somebody dealing with this, somebody casting a frame, or somebody casting a gold crown, somebody doing this, somebody doing the other. Now, we can use the technology to get you the information quickly and efficiently, but there's a little bit of everything.
Absolutely.
I always say that.
Well, it's a good attitude. You have to say that. It's like everything's square, everything's a circle. It's not. I mean, every case, every patient's different. So you got to just, there's not one procedure that fits all. I mean, it's just, you got to have such an open mind, and to be able to do the right thing, you have to do what's best and not just what you got in your office. Like, hey, I'm going to make a CEREC on everything in here. No, I mean, and that's not what dentists do. I know they use it for, restorations they can do, maybe some inlays or onlays or maybe some single crown, stuff like that. It's just, it's neat when a doctor does know the limits and the, of what, materials will, are good for these patients and what aren't. So that's pretty awesome. But what do you think, what advice could you give some of our newer dentists just starting off, some of the do's and don'ts?
Just one very basic thing. Treat people, not teeth.
There you go. That's a good one.
I mean, it's part of going to dental school. You get into this mindset. Oh my goodness, I need to complete so many root canals, or I need to complete so many extractions, or I need to complete so many crowns or class 1 fillings, or this or the other. You know what I mean?
Yeah, exactly.
And then you end up getting that tunnel view. It's like everything revolves around that tooth. Many a time, what I do see, the people that come to me is, yes, they've had very good dentistry, but they treated the tooth. They didn't treat the person.
There you go.
And many a time people come to me to say, can you give me an opinion on this, or I'm dissatisfied with this? And it's like, you know what? Your restoration is perfectly good, but it's treat the person.
Treat them right. Show them what their options are, what what you recommend, and treat them well, and good things will happen, man, for sure.
And the other thing is, nobody is a perfect match for everybody. And that's also another thing that I tell people that come to me for first-time opinions, that, you know what, I may not be the right match for you.
There you go.
But I think honesty has got to be at the core of whatever we do.
Words of wisdom, baby. That's awesome. So how's my lab doing for you? Are we doing all right? Are we dropping the ball?
You guys are doing great. You guys are doing great.
Thank you, son. How'd you hear about my lab? Do you remember it all?
Actually, you know what? When I was in LSU.
Oh, you're kidding. Oh, that was probably...
when I was way back when.
No kidding.
Even when I practiced back home. I was always coming to the U.S. There's this new revelation in aesthetic dentistry. So, hey, here you come to a meeting and everything. And I would see your, at the dental meeting.
Okay.
I would see your brochures. I would talk to your guys. I think you and I crossed paths more than once in a meeting and shook
Right.
hands.
I think
And
so.
it was just one of those things.
Ah, that's so cool, man.
You know, I guess you go making imprints.
Yep. Oh, yeah.
And that's how eventually, you know.
Yeah, I think we have a big fan out there at LSU too, Dr. Jerome Smith, Jerry Smith. He's a big impact guy, and I love him, man. I've done his work for a long time, and he's a wizard, man. But it's just such a small world in the dental field, and it's just neat, you know. We all work together. We all kind of work for these patients, man, and we try to do our best job. And it's just a neat thing when you get guys passionate about it like yourself. And man, I just I can't thank you enough for all the work that you send us, but just all the great, you know, work and just your great attitude. And I can't thank you enough for coming on up on the Dental Up podcast, man. It was a good one, baby.
Well, thank you for the opportunity, man, and happy to do.
Oh,
happy to do.
Well, you got it, man. Thank you so much. And again, if there's anything you do, please let me know. But again, thanks for coming on, and we'll talk to you again real soon.
Okay, brother. God bless you all, and take good care of you.
God bless you, and we'll talk to you soon. Thanks again, doctor.
Okay, bye-bye.
Right, bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.